Usually the first tooth in a kid erupts at 6 months of age, which is usually the lower front teeth. But if the teeth is not yet out by first birthday, I think you should visit your kid's dentist and check for the factors which I have discussed in this video, that why the particular teeth is not out at the appropriate age group. Namaskar parents, I am Dr. Deepesh Prajapati, dentist just for kids practicing in Jaipur, Rajasthan. Let's discuss today that what are the common reasons that why do young kids often get their first tooth in their mouth so late. So coming to top 5 reasons that why do kids get their first teeth late. The most common reason and the problem which is pandemic probably in the whole world these days is deficiency of vitamin D. Kids are often not getting adequate sun exposure when they are born. They do not play in the open air, and plus when the mothers are pregnant with them, they do not expose themselves as well to the appropriate sun exposure, and hence the mother itself is a vitamin D deficient pregnant lady, and when eventually the boy gets or the baby gets born, he or she also suffers with a vitamin D deficiency. This vitamin D not only makes your teeth erupt late in the oral cavity, but they also lead to less immunity fighting against common infections. They often lead to more cavities. They often lead to crooked teeth. So appropriate sun exposure as per the age group of the child is very, very, very important, just not for the early tooth or just not for the timely tooth eruption. Second common reason could be global developmental delay. Few kids do not attain the proper developmental milestone at the right time. They are called as global developmental delay. They do not start walking with support, start walking without support, start running at the appropriate time. In such kids you can expect, yes, the teeth will come out late. They usually are often found to be short stature as well, not attaining the adequate height or weight as per their age group. Third common reason of having late teeth is birth history. Kids who are born with very low birth weight or are born prematurely, they often show, as I said, developmental delayed milestones, and it is found that if the baby was not sick during its prematurity, he might attain or catch up with the growth with the other, just like other kids. But if the child was sick during the prematurity, you can expect the teeth to come out late as well for such kids. Another reason I can think of is diet. The fourth reason is diet. I often found that young kids are too much on the soft diet. They do not chew teeth and they do not chew the age appropriate food, and once they do not start using their gums to mash the soft food, they do not get enough massage of the gums, and hence the blood circulation in the gums get affected, and which I personally feel can be a contributory factor, that since the gums are not getting massaged enough, the blood flow is not enough and the teeth come out late through those gums. Fifth and the last is probably a rare genetic condition which I commonly find in my private practice is ectodermal dysplasia. These kids often do not have the right number of teeth forming itself. Few teeth are missing since their birth, and since the teeth is not formed, it will never come out, so the parents think that the teeth are coming out late. For such kids, a dentist can take an X-ray and then evaluate that whether the tooth is there or not. And how to suspect ectodermal dysplasia in kids who do not have their teeth at the right time. They usually don't have a good amount of hair on the head or the eyebrows. They often sweat less and things like that. If you can consult your pediatric medical doctor to look for such conditions. If you have doubt related to the same topic, you can either email me on the given email ID or put your doubt in the comment sections below. I will definitely try to help. Namaskar.